Hello, my dear budding doctors. I welcome you all to my YouTube channel, Medicos Notes. Today, we'll be starting with the new series that is the important short answers of thorax. I hope you all love the previous videos on upper limb and lower limb. So, now let's start with this session. Okay, the first question we'll be seeing is terminal branches of internal thoracic artery. So, we all know the internal thoracic artery is also known as the internal mammary artery. Okay. It also supplies the anterior body wall and its associated structure, that is from the clavicle to umbilicus. In the anterior body wall, the structures are supplied by the internal thoracic artery. Okay. The next point is that the internal thoracic artery arises from the first part of subclavian artery in the base of neck. So we all know that internal thoracic artery is a branch of subclavian artery, and it also arises from the first part of subclavian artery. Okay. Now moving on to the next point, it then passes from the neck to the thorax, posterior to the subclavian vein and first rib. So here they have given the course of the internal thoracic artery. Okay, so they have said that it passes from the neck to the thorax, posterior to the subclavian vein and the first rib. Then the question they have asked here is the terminal branches of internal thoracic artery. So internal thoracic artery itself has 5 branches, and the terminal branches are musculophrenic artery and superior epigastric artery. The other 3 branches are given here. The first one is the anterior intercostal arteries. The next one is the pericardiophrenic artery, and the third one is the perforating cutaneous branches of internal thoracic artery. So altogether, learn these 5 arteries. If they have asked the terminal branches, you can write these two. If they have asked the branches all together, you can write these 5 branches. Okay, now you can also see this diagram. So this is a subclavian artery. From there the internal thoracic artery arises. So then here they have given the terminal branches of internal thoracic artery, that is the superior epigastric artery and musculophrenic artery. Okay, now moving on to the next question. Pleural recess. So the site where parietal pleura of one surface comes in contact with the parietal pleura of other surface is called pleural recess. So as you can see in this picture, this is the lungs. Okay, surrounding the lungs we have the parietal pleura of the lungs, which is known as the costal pleura, and surrounding the diaphragm we have the parietal pleura of the diaphragm, which is called the diaphragmatic pleura. Now the region where the parietal pleura of the lungs and the parietal pleura of the diaphragm, the costal pleura and diaphragmatic pleura, comes in contact with each other. So this region, a small space is formed in this region, and this is called as the pleural recess. Okay. The second point, you can see at these sites the 2 layers of parietal pleura are in contact with each other at the inner surface. So that is what we have seen now. Then there are 2 recesses present in each pleural cavity. So the pleural cavity itself has 2 pleural recesses. The first one is the costodiaphragmatic recess, which is formed between the costal pleura and the diaphragmatic pleura, and the second one is the costiomediastinal recess, which is formed between the costal pleura again and the mediastinal pleura. So the mediastinal pleura is the pleural parietal pleura of the mediastinum. Okay. Okay, now moving on to the next question. Boundaries and contents of posterior mediastinum. Okay, now see in this picture, this is the anterior mediastinum. You all know what is mediastinum, just giving a recap. Okay, this is the anterior mediastinum, this is the middle one, and this is the posterior mediastinum. Now they have asked us the boundaries and the contents of posterior mediastinum. So now look this picture, friends. When you see this picture, now this green color covered space is the posterior mediastinum. Now the boundaries anteriorly, you can see the pericardium, you can also see the bifurcation of the trachea, you can also see the pulmonary vessels, and the posterior part of upper surface of diaphragm is located anteriorly. Okay, now posteriorly, what you can see, posteriorly there is the thoracic vertebra is located, and also on each side there is mediastinal pleura also. So these are the boundaries of posterior mediastinum, and the contents are so for contents I have given a mnemonic, that is dates. Okay, so D denotes descending aorta, A denotes azygous vein, hemiazygous vein and accessory hemiazygous vein, T denotes thoracic duct, E denotes esophagus, and S denotes sympathetic trunk and its associated lymph nodes. Okay, so for two more question, I think it's better to draw the diagram and explain the answer. Okay, so it will yield you more marks. Now moving on to the next question, arch of aorta. So the aortic arch represents the direct continuation of ascending aorta. We all know the ascending aorta, it then continues as arch of aorta, and then the arch of aorta, it goes down as descending aorta. So origin, continuation of ascending aorta at the level of sternomandibular joint. So ascending aorta continues as arch of aorta. Okay, now the course, the arch from it arches from right to left and front to back and lies anterior to the left of trachea. So it is located left of trachea, and it arches from right to left and front to back. Okay, now the main branches of arch of aorta are, yes, brachiocephalic trunk, left common carotid artery, and left subclavian artery. Okay, yes, super. Now, what does this arch of aorta supply? It supplies the head, neck, and the upper limb all over. The branches of arch of aorta supplies the all these regions. Okay, now the termination. So that also we know it just continues as descending aorta. So adjacent to the lower border of T4, it continues as descending aorta. Okay, now we have to write the relations of arch of aorta. Okay, so sometimes specifically they will ask, write arch of aorta, explain the relation. So now we have to explain the relations also. Now relations superiorly, you can see here, what are the regions you can see here. The three branches of arch of aorta is located superiorly, that is the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. Okay, now moving on, the inferiorly located relations. So you can see here, this is the, no, this is the left bronchus. Okay, this is the bifurcation of pulmonary trunk. This is the ligament arteriosum. So what is ligament arteriosum? Yes, that is a remnant of ductus arteriosus. Okay, which is a ductus arteriosus is a fetal blood vessel. Okay, super. And also there is left recurrent laryngeal nerve. So these are the inferiorly located structures. Then posteriorly, so posteriorly you can see this is our arch of aorta. Posterior you can see the esophagus. You can see the, yeah, you can see the thoracic duct. You can see the behind this there is vertebral column also, and also you can see here this is the left recurrent laryngeal nerve. Okay, now anteriorly, so anteriorly we have the left pleura, you have the pleura and the lung, you have the left recurrent laryngeal nerve, you also have the superior intercostal vein. Okay, so the superior intercostal vein is also located anteriorly. Now moving on to the next question, they have asked the surface marking of apex beat of heart. So it is also a very important question. They have asked it often, no, at more than 3 or 4 times they have asked this question. So apex beat is nothing but it is a visible palpable cardiac impulse that can be, okay, it can be seen. So it is a visible palpable, you can also see it, and also it is a palpable cardiac impulse. Okay, so now we have see, you have to see the location. It is in the left fifth intercostal space. Now first trace the left fifth intercostal space and look from 9 centimeters. So this is a mid-sternal line. Here you have to draw the mid-sternal line. So 9 centimeter from the mid-sternal line, and also medial to the mid-clavicles. This is a clavicle, this is a mid-clavicular line. Medial to the mid-clavicular line we have the apex beat of the heart. Okay, so this is a surface marking. Usually they will ask for surface marking. Even if they ask as a 2-mark question, draw this diagram, locate it and explain it. Okay, the next question, azygous vein. The azygous venous system is located on either side of the vertebral column and drains the viscera within the mediastinum as well as the back and thoraco-abdominal walls. So this they have said that the azygous vein now drains most of the viscera within the mediastinum and also the back and also from the thoraco-abdominal walls. Okay, now mostly they'll ask you the tributaries of the azygous vein. Okay, so we all know the tributaries of azygous vein, that is a hemiazygous vein, and the other one is a accessory hemiazygous vein. So you can see in this picture, this is azygous vein. Okay, here it is arising from the, yes, it is arising from the inferior vena cava. It is arising from the inferior vena cava, the azygous vein, and these are the two branches. Okay, see, first one is the accessory hemiazygous vein, and next one is the hemiazygous vein. Okay, now the azygous vein usually either arises from the lumbar azygous vein or from the posterior side of inferior vena cava. So usually in some individuals this azygous vein arises from the lumbar azygous vein, okay, and also it's some in some individuals it arises from the posterior side of inferior vena cava. Now the next one is it passes through the diaphragm, reaches the mediastinum and drains into the superior vena cava. So here they have given the course of the azygous vein, okay. So it passes through the diaphragm. So from diaphragm it then reaches the mediastinum and then it drains into the superior vena cava. Okay. Now the azygous venous system has many anastomosis with inferior vena cava and vertebral venous plexus. This makes it an important connection between the two vena cava, which allows alternate drainage route in case of inferior vena cava obstruction. So what they have given here is the azygous vein, it has a lot of anastomosis. Anastomosis means connection, okay. This azygous vein venous system has lot of connection with the inferior vena cava. So even if there is a obstruction in inferior vena cava, this azygous venous system can provide an alternate pathway for its drainage, okay. So that's it. That is the point they have explained here. So this is also an important question that has to be remembered. Just no draw this diagram, okay. You can draw the diagram and explain the tributaries, okay. Now moving on to the next question, triangle of Koch. So triangle of Koch is not there for us in the syllabus, but also they have asked a short answer. They have asked this question at least 2 times, I think. So we have to know, okay. So triangle of Koch is nothing but it is a no, it is a triangular space in the lower arterial septum of the heart, okay. So at this region, lower arterial septum. So this is arterial septum. In the lower arterial septum, a triangular region is known as the triangle of Koch, okay. And why is it important? Because it is an important landmark for localization of atrioventricular node for atrioventricular catheter ablation procedure. So for any procedure, localization of atrioventricular node is done by the triangle of Koch, okay. This atrioventricular node is located in the triangle of Koch. Now the important one is mostly they'll ask you the no the borders. They will ask you the relations of this triangle of Koch. So first one, the posterior border. You can see in this diagram the same as here. This it has magnified version is given here. You can see here the posterior border is formed by the tendon of Todaro. Yes, and the anterior border is formed by the tricuspid annulus. Okay, so tricuspid leaflet form the anterior border, and the base is formed by the coronary sinus orifice. So below here is the coronary sinus orifice, and the base is formed by coronary sinus orifice. Okay, so these are the borders of triangle of Koch, and triangle of Koch is nothing but a triangular space in the lower arterial septum and is important in the localization of atrioventricular node. Okay, that's it for this session. I think we have covered the important short answers of thorax. I hope you will love this. If you have any questions, you have any comments, you can drop down in the comment box below. Thank you for listening, doctors. Thank you so much.